Case study by Natalie Waldo. Throughout this case study, we will walk through the summary of the case, evaluating alternative options, applying ethics theory, taking a position, and looking to the future. Welcome to my case study for ethics for professionals. Part 1, a summary of the case. What happened? A plastic surgeon, Dr. Adrian Malavi, was able to perform surgeries while under investigation by the Medical Board of California. He was under investigation because of a patient who passed away as a result of a procedure done by Dr. Malavi. During that time, Dr. Malavi was able to continue taking patients and performing surgeries. The patient death happened in 2018. In May of 2022, the Medical Board of California had reached a conclusion, and Dr. Malavi's license was to be suspended, though it was not suspended until October of 2022. In the time of the investigation, he nearly killed another patient with a liposuction procedure. The patient fell into a coma and spent 2 months in the hospital because of necrotizing soft tissue and an infection. He also performed a breast procedure that led to another incident of necrosis and a patient who had to be admitted to the ER. In a revisionary surgery by Dr. Malavi, he performed an unplanned double mastectomy. All of these procedures happened during the time that Dr. Malavi was under investigation for negligence in the case of a patient death. 30 other patients are named in a suit against Dr. Malavi for medical malpractice. This happened in Laguna Beach, California. The other patients who are named in the medical malpractice suit were able to be victims of malpractice because Dr. Malavi was able to continue practicing, committing alleged malpractice because the Medical Board of California did not suspend his medical license during the investigation. It happened as a result of negligence on the part of the surgeon, but primarily it was allowed to happen by the Medical Board of California. The consequences of not suspending his license led to other patients falling victim to surgical errors, necrosis of the skin, emergency and hospital room stays based on infections and related to surgical procedures performed by Dr. Malavi. The moral agent is the Medical Board of California. Relevant stakeholders include all patients of Dr. Malavi in the time that the investigation was ongoing, as well as all other doctors who might be under investigation for similar behaviors who have not had their licenses suspended during that investigation. The core ethical dilemma is whether or not the onus is on the state medical board to prioritize the health of future patients as it investigates fatalities in relation to potential error on the part of a plastic surgeon. Virtue. As a governing body, the Medical Board of California should have a responsibility to continuously improve their work with an emphasis on keeping safe both patients and surgeons. As an assumedly virtuous governing party, the board has a responsibility to the patients to keep them safe from potentially dangerous and life-threatening events. Who does the state medical board have a duty to protect? Is it their duty to protect surgeons or patients? Should it be the duty of the medical board to suspend all licenses for fatal malpractice claims? If the duty is to protect against malpractice, then it is the board's duty to protect potential patients of plastic surgeons under investigation for malpractice when that malpractice results in a fatality. As a governing body, where does the responsibility of the Medical Board of California lie? What is their duty to the patients and medical professionals under investigation, and what is their duty to those patients? Part 2, evaluating alternatives. Option 1, suspend licensing for the duration of the investigation in the event of a fatality related to surgical procedures. Option 2, put protocols in place to notify new patients of ongoing investigations in the event of patient fatality to allow patients to make the most informed decision possible. 3, allow surgeons to continue practicing while under investigation for malpractice where fatality is involved. I believe the Medical Board of California chose to allow Dr. Malavi to continue practicing medicine while being investigated for patient fatality because of the policies put in place that are not favorable to patients, but do have doctors' best interests at heart. Part 3, applying ethics theory. The core elements of duty is determined by the acts that are predetermined as right and wrong. People, or in this case medical boards, are expected to act in accordance with a duty to do the right thing regardless of the consequences of those actions. The core elements of virtue is that virtue is created by our actions when they exemplify courage, loyalty, or wisdom. Virtue ethics say that our actions shape our character, and what we do is what directly determines who we become. Governing parties should behave in a virtuous manner by being the best that they can be and by prioritizing what is best for the safety of all. For each Option 1 stated that the medical board should suspend licensing for the duration of the investigation and the event of a fatality related to surgical procedures. This option would be the most ethical as it exercises its duty to protect patients from potentially dangerous and life-threatening situations. Option 2 puts protocols in place to notify patients of ongoing investigations in the event of a patient fatality, to allow patients to make their own decisions, as well as it gives the surgeon the ability to keep practicing. This option appears to, on the surface, be the most appealing option for all involved parties. However, patients are putting their lives in the hands of the surgeon, meaning that it is the duty to keep the acted upon safe. Creating protocols would give awareness to ongoing suits and would allow patients to have informed opinions. Option 3 is exactly what the medical board did. They chose to allow the surgeon to continue practicing medicine while under investigation following the death of a patient. This option protects the surgeon from lost business, but does not in any way protect patients from the actions of the surgeon or notify them that there have been any issues regarding patients hindering them from the ability to make an informed decision. Part 4, taking a position. The Medical Board of California failed ethically in this case. Based on the ethical theories applied to the event, I find that the Medical Board of California should have suspended the license of Dr. Malavi as soon as the investigation into a fatality of his patient started, as this would have protected future patients from being subjected to potential malpractice, negligence, and overall incompetence, which presented itself as skin necrosis, flesh-eating bacterial infections, and an unplanned double mastectomy. All these procedures totaled over $2 million in hospital bills, plus the cost of reconstructive surgeries. In these circumstances, I would have suspended the license of Dr. Malavi because my responsibility as a governing body is not to keep doctors safe from litigation, but to keep patients safe from malpractice and potentially life-threatening negligence. The alternative behavior produces more ethical outcomes as it would stop surgeries after fatal medical events following a medical procedure from happening. This halts any potential dangerous procedure while investigation into fatality takes place. My preferred course of action is preferable to what was done because it focuses on saving the health and potentially lives of future patients. One criticism could be the question of who is looking out for the surgeon. If their medical license is immediately suspended whenever there is a fatality related to a procedure they performed, what happens to their business and their employees? My response to those criticisms is that lives are more important than surgeons' ability to perform elective surgeries. It is also important, especially in the event of a fatality, to make sure that all future patients are not needlessly or neglectfully put into harm's way. Part 5, Looking to the future.